topic for today's presentation is the bacterial spectrum among urinary pathogens and its antibiogram from January to June 2021 during second wave of COVID-19 at a tertiary care hospital. Let's discuss this presentation in the following side headings: introduction, aim, objectives, materials and methods, results, discussion and conclusion. Introduction: urinary tract infections are one of the commonest infections among all age groups, but more susceptible to women compared to men because of their anatomical structure. They can be caused by both gram-negative and gram-positive bacteria. The multiplication of these organisms in urinary tract leads to an inflammatory response. That is, the patient may present with fever and chills. Therefore, the study gained importance because if there is improper diagnosis or inadequate treatment of such UTI patients, it may lead to irreversible renal parenchymal damage and scarring and ultimately renal failure. And it may be life-threatening condition for the patient. Therefore, empiric antibiotics have to be started as early as possible to prevent chronic UTIs and its complications. Drug resistance in uropathogens have been increased in the past few decades due to unselective use, easy availability, and over-the-counter sale of antibiotics. Hence, antibiotic resistant profile is crucial for better management of patients because of UTI associated with multiple drug resistant bacteria, and it helps us to timely update optimal empirical therapy of UTI. The aim of this study is to study the bacterial spectrum and its antibiogram and to recommend changes in the local empiric antibiotics policy. The primary objective of the study is to assess the types of isolates from the patients with UTI by conventional culture methods. The secondary objective of the study is to determine the current antimicrobial susceptibility profile. Materials and methods. This is a tertiary care hospital-based retrospective study of 6 months, that is from January to June 2021 after permission from scientific committee. All the urinary samples which have come to microbiology department from various clinical departments of different age and gender were assessed. The patients who already started antibiotics were not considered. A total of 1,358 urine samples, including 884 females and 474 males, were processed and studied during this period. Each sample was inoculated on blood agar and McConkey agar plate and incubated at 37 degrees centigrade for 18 to 24 hours. For identification of isolates, standard microbiological methods such as conventional diagnostic methods, which included gram staining, was done, and based on Gram's reaction, various biochemical tests were performed, such as for gram positives, catalase, coagulase, vesitracin, and novobiacin were done, and for gram negatives, glucose and lactose fermentation, indole motility, TSI citrate, and urease were done. Antimicrobial susceptibility tests were done on modified Kirby-Boyer disc diffusion method on Mullen-Hinton agar in accordance with clinical laboratory standard institute guidelines using criteria of standard zone sizes of inhibition to define sensitivity and resistance. The antimicrobial agents tested for gram-negative organisms and gram-positive organisms were different. The results were determined after incubation at 37 degrees centigrade for 24 hours as per CLSI guidelines, that is Clinical Laboratory Standard Institute guidelines. Let's discuss results along with the discussion part. A total of 1,358 urine samples were obtained from various departments during 6 month study period. Among them, the female samples were coming more. That is, a total of 65% female samples came during the study period and only 35% the male samples were coming up. Significant growth of organisms were seen in 208 cultures, that is 15% cultures, and there was no growth or insignificant growth in the rest of the cultures, that is 84.6%. The female samples were coming more compared to males, and even in the positive cultures, females were majority, that is 64.4% were females, and males were only 36%. And among the positive cultures, there were 3 types of organisms isolated: gram-negative organisms, gram-positive organisms, and Candida species. The gram-negative organisms were majority. That is 47% were gram-negative organisms and only 20% were gram-positive organisms. This is the pie chart which shows that female samples were coming more to the microbiology department for the urinary cultures. That is 65% female samples were coming. This is a donut chart depicting only the significant growth was seen in 15.3% samples. This is a pie chart depicting that female samples were outnumbering the males in the positive cultures. This is the bar diagram which shows that gram-negative isolates were in majority compared to the gram-positive isolates, and the rest 32% were the Candida species. This is the bar diagram showing the age and sex distribution. Below the age of 1 year, males were outnumbering the female patients in the positive UTI cultures, but the gap between the 1 year to 5 years, male and female ratio were equal. And above the age of 5 years, the females were outnumbering the male patients in the positive UTI cultures. The organisms or isolates identified in the positive urine cultures. Candida with 32%, and among the gram-negative organisms, E. coli was the most common, and the second most common was the Klebsiella species. Klebsiella species included Klebsiella pneumoniae and Klebsiella oxytoca. They both were differentiated based on the biochemical tests, such as indole, etc. And the next organism in the gram-negative organism was Pseudomonas aeruginosa, Proteus species, and Acinetobacter species. Among the gram-positive organisms, Staphylococcus and Enterococcus were seen. Among the Staphylococcus species, there were Staphylococcus aureus, MRSA, and Coagulus-negative Staphylococcus aureus. This bar diagram shows us that Candida species were and among the gram-negative E. coli, then Klebsiella, and next the gram-positive Staphylococcus species, and next again the gram-negative organism that is Pseudomonas aeruginosa, and next again the gram-positive Enterococcus species, then Proteus species, then Cons, and the Acinetobacter species. According to the percentages of the gram-negative and gram-positive organisms, this is the bar chart. Antibiotic resistant pattern of the gram-positive isolates. There were many antibiotics taken into consideration, but among the Staphylococcus, Enterococcus, and Cons, vancomycin showed 100% sensitivity for all the three gram-positive organisms. For the gram-negative organisms also, there were many antibiotics taken into consideration, but imipenem, norfloxacin, and gentamicin and nitrofurantoin showed more than 75% sensitivity compared to the other antibiotics. Discussion part in this study, when compared with the other studies, these study also showed that female samples were more compared to the male samples, but even when the positive cultures were taken into consideration, females were more positive compared to the male UTIs. And gram-negative bacteria were dominant isolates compared to gram-positive bacteria. This is in agreement and conformity with previous studies done in India and various other countries, not only in India, but also the other same similar studies done around the world. It shows the same result. Therefore, my conclusion is, my study suggests that this steering committee of the conference has to focus on implementation of antibiotic policies and necessary standard operation procedures to be taken to prevent further development of multi-drug resistant bacteria. Thank you.